Hello, everyone. Welcome to my presentation entitled A Meta-Heuristic Multi-Objective Approach to the Design of the Convolutional Neural Networks for Urinary Bladder Cancer Diagnosis. My name is Ivan Lorenzin. I'm a teaching assistant and PhD student at the University of Rijeka Faculty of Engineering. This paper was written in collaboration with Dr. Klara Smolic, Professor Dejan Markic, and Professor Josip Španjol, all from Urology Clinic of Clinical Hospital Center in Rijeka. As you can see in this presentation, this approach is pretty much interdisciplinary, and it includes and it consists of multiple approaches. One is medical and the other is engineering, computer engineering approach. Urinary bladder cancer represents one of the most common malignancies in the urinary tract. It is characterized by a high metastatic potential and a high recurrence rate. This metastatic potential and the recurrence rate significantly complicates diagnosis and treatment. So it must be noted that correct and timely diagnosis is absolute imperative during diagnosis and treatment of urinary bladder cancer, because an inaccurate or inaccurate diagnosis significantly lowers the probability of the survival. In order to increase the accuracy of this diagnosis procedure, algorithms based on artificial intelligence, mainly image recognition techniques, are introduced. This research is based on the principle of convolutional neural network model selection that is based on a multi-objective meta-heuristic approach that maximize both generalization and classification performances of the aforementioned CNN. For the purposes of this research, 2,525 images of urinary bladder mucosa that are obtained with confocal endomicroscopy during cystoscopy are used. Cystoscopy is a standard diagnosis procedure that is used during diagnosis of urinary bladder cancer. Together with physical biopsy, represents a golden standard in diagnosis of urinary bladder cancer. On the other hand, if a confocal endomicroscopy is used, some improvements are achieved. So by using this approach, less invasive procedure is performed due to horizontal cut, as can be seen on this image. Furthermore, this approach enables the in-time diagnosis in vivo, in difference with physical or classical biopsy, where delayed information about tissue, about if the tissue is cancerous or grade of the cancer, is delayed due to the fact that this tissue must be cut off and bring to pathologist that examines this tissue. In the case of optical biopsy, this procedure is performed in vivo by a physician that performs the cystoscopy. Images collected by endomicroscopy during cystoscopy are divided in 4 classes. These classes are high-grade carcinoma, low-grade carcinoma, carcinoma in situ, and healthy mucosa. By healthy mucosa, in fact, healthy mucosa represents non-cancerous tissue, while other issues like inflammatory changes are included in this class, healthy mucosa. Number of images, as we can see, non-cancer tissue, high-grade cancer, low-grade cancer, carcinoma in situ are pretty much in the same range, more and less. So we can conclude that this data set is pretty much balanced. So the data set as it is will be used in this research. For the purpose of image classification, two different CNN predefined models are used. These are AlexNet architecture and VGG16 architecture. These architectures represents standard architectures used in multiple image recognition and computer vision tasks. It must be noted that there are more complex CNN architectures, but during this research we have concluded that by using this more simpler architecture, satisfactory results are achieved. So there is no need for utilization of more complex CNN architectures for these tasks. So models of these two hyperparameters of these two CNN architectures will be defined by using two multi-objective meta-heuristic algorithms for model selection. These are genetic algorithm and discrete particle swarm algorithm. Genetic algorithm represents pretty much standard evolutionary algorithm that is based on the two main variation procedures. One is mutation, the second is crossover procedure. Each chromosome that is used in this genetic algorithm represents one CNN model. Mutation procedure is based on the change of random selected gene, and must be noted that each gene in fact represents one hyperparameter of a CNN. Crossover procedure is a little bit different because it represents one of the novelties of this this paper because of the three branches of the crossover procedure. Crossover method is selected independence of this random variable C. We can see the first crossover method is based on the combination of two parts of two chromosomes. Second crossover method is based on the based on defining the new chromosome by using three parts of two chromosomes, two parent chromosomes. So we took two parts of one chromosome and the third part of the second chromosome. And the last crossover method used in this research is based on the random crossover between two chromosomes. So two child chromosomes are defined by using random genes interchangeably one or other parent chromosome. The other approach is particle swarm, discrete particle swarm algorithm. This algorithm is based on the discrete variation of a standard particle swarm optimization algorithm, where each particle represents one convolutional neural network. Whole population is defined as a swarm. One difference between this discrete particle swarm algorithm and the particle swarm optimization algorithm is the fact that in this case, hyperparameter space, hyperspace that is used for search through search through the hyperparameter space. This hyperparameter space is in fact discrete or integer lattice. This integer lattice is defined because due to the fact that hyperparameters can be defined only as discrete values. So we can have 102 quarters of epochs, training epochs. So we must have strict integer values. So all hyperparameters are generated on are defined by an integer value in the integer lattice. So only difference between particle swarm optimization and the discrete particle swarm algorithm is that after defining after unparticle values or hyperparameter vector of the particle is defined, each element of the vector must be discretized back to the element of an integer lattice that in fact represent one hyperparameter value. Another novelty of this paper is this multi-objective fitness function. Fitness function that incorporates classification and generalization performances. Classification performances with this psi, mean psi, and generalization performance with sigma of psi. Psi represents AUC value that represents the classification performances, while sigma of AUC represents generalization performances. And by utilizing this single fitness function, we will in the same time maximize generalization and classification performances of a convolutional neural network. By using the presented algorithms, we have generated some models. As can be seen from the results, if a discrete particle swarm approach is utilized, high classification and generalization performances are achieved regardless of which CNN architecture is utilized. So we can see that if we use more simple AlexNet architecture combined with the discrete particle swarm algorithm for model selection, high classification and generalization performances are achieved. On the other hand, if genetic algorithm is used, we can see that a little bit lower classification and generalization performances are achieved, but it must be noted that regardless of a little bit lower value in comparison with discrete particle swarm, these classification and generalization performances are still pretty much high. So by using these two algorithms for model selection that are based on the presented multi-objective fitness function, we can see that high classification and generalization performances are achieved regardless of CNN model utilized. On this, these results are pointing towards the opportunity for the utilization of more simpler CNN algorithms in comparison with that I have mentioned earlier, such as ResNet, Inception, and so on. These standard deep learning algorithms, enhanced with a multi-objective meta-heuristic approach, are enabling high classification and generalization performances regardless of their simplicity. At the last slide, I will show that we can see that by using discrete particle swarm, high fitness value that incorporates the generalization and classification performances are achieved after only 4 generations, while if genetic algorithm is used, little bit lower values are achieved after 18 generations. So from this figure, we can conclude that by using discrete particle swarm algorithm, regardless of CNN architecture, we can see that high classification and generalization performances are achieved for both CNN architectures after only 4 generations, pointing towards conclusion that this approach is faster converging that approach based on genetic algorithm. That will be all. Thank you for your attention. If you have any question, please contact me on my email that is available on the paper in the conference proceedings. And I hope that I will see you next year in Kragujevac. Have a nice day.